Welcome, everyone. On behalf of Therapy Ed, it's my pleasure to present this webinar on enabling success on the NBCOT certification exam, effective preparation strategies and resources. I would like to begin by talking about the NBCOT content and format. As noted this morning by Dr. Williams, the NBCOT exam's content are constructed based on surveys of OT practitioners. So it is good to know that what you will be tested on is based on practice. So it's based on the things that you observed in fieldwork and that you learned about in school. And this analysis of the practice surveys identified the domains, tasks, and knowledge that are required for entry-level OTR and COTA practice and the content of their exams. Now, there is more information about the specifics of the exam at NBCOT.org, and our exhibit booth videos also provide additional information about the NBCOT exam. But an important thing to know is that the exam tests generalist knowledge that is required for entry-level practice. There is a post on the NYSOTA exhibit booth of one of the exhibitors that states that students make a mistake by being a generalist instead of a specialist. That statement is wrong, okay? As Dr. Williams noted this morning, there's a lot of incorrect information put forth, so you need to always check that the source is reputable. And of course, NBCOT.org is the place to go, and Therapy Ed is very, very conscious of making sure we check to make sure all the information we provide is accurate. So remember, the exam is a generalist exam. It does not require specialized knowledge. And Chapter 1 in each review and study guides provides more information about the NBCOT exam content, format, and procedures, and test-taking strategies for selecting correct answers. So I encourage you to read that chapter, and again, it is based upon the latest documents of the NBCOT. Another thing to know about the exam is that it does test your knowledge at a higher level of objective exam items. There are 4 levels of types of objective exams, and the first one is knowledge, and that was what when you were learning the difference between kinesthesia and proprioception during your entry-level OT education introductory courses. And you need to know the difference between proprioception and kinesthesia, because you need to understand how, if someone had a deficit in one of those, how it would impact and the significance of it and the consequences or implications on function. But on the exam, they're not going to ask you to define those. But understanding it is key, because you're going to need to apply your knowledge to different new situations that are presented in a clinical situation, an exam item, and you're going to need to analyze. So you need to analyze an activity, and how does that relate to someone having problems in proprioception, or a kid with a sensory processing disorder needing a lot of proprioceptive input. So you need to analyze an activity. This is the level where the exam is at, application and analysis. However, to determine correct answers for these higher level items, you need to know the depth and breadth of OT practice, and you need to comprehend these complexities and ramifications and nuances. And this is where the use of clinical reasoning comes in, and critical reasoning. Due to time constraints, I'm not going to talk about critical reasoning, but that's covered extensively in both the review and study guide and our course manual and during our course. But I will highlight clinical reasoning for today. Okay, these are probably familiar with you, these terms: the procedural reasoning, which is by the book, interactive client-centered, conditional is our individualization of treatment, and the pragmatic, can it be done? And reviewing and applying these is what is going to help you select the correct answer. And as mentioned early this morning by Dr. Williams, NBCOT exam outline identifies specific tasks, and one of the tasks is develop an intervention plan by using clinical reasoning and therapeutic use of self. And these hints are throughout the book to highlight what is must-know information. So I'm going to talk about procedural reasoning in more detail. Basically, that is the by the book of what you need to know about diagnosis and symptoms and etiology for all the different conditions that occupational therapy practitioner may work with. You also need to know prognosis. If something is progressive, you're going to work with the person differently than if they have something that can be remediated with a biomechanical approach, say like a rotator cuff disorder, rotator cuff tear, you're going to use a biomechanical approach. You have someone who has a progressive disorder like ALS, you're going to use a compensatory approach. So this is key information to determine the best answer. And an example throughout the book, we have tables that highlight must-know content. An example would be knowing right versus left hemispheric specialization, which would be critical for understanding a question about someone who've had a CVA. And the NBCOT identifies knowledge of the impact of body functions and body structures on occupational performance as essential for both levels of practice. And chapters 6 through 10 in our review and study guides provide that information about body system disorders and the conditions that we may be working with. The procedural reason is also tested on the exam because we have a lot of protocols, by the book of how do you measure a wheelchair, how do you construct a splint, the Duran protocol, the Klerner protocol. Okay, so knowing those procedures is going to help you get the correct answer. And those are described in chapters 11 through 16 in the OT and 11 to 15 in the OTA. And they're described according to theoretical models because the NBCOT exam outline states that knowledge of applying different theoretical models of practice and frames of reference that guide interventions in a variety of practice settings is essential for competent practice, both for the OT and for the COTA exam. Okay? And knowing this by the book information is key for both the OT and COTA exam. Domain 1 is focused on evaluation. Domain 2 is focused on treatment planning for the OTR and treatment planning and intervention for the COTA. And in the OTR, Domain 3 has a separate category for treatment implementation. Conditional reasoning. I always find it very heartening. That's when students feel very good with that. They know that the exam does ask you to think about the special conditions of a person's life in the scenario. So selecting the correct answer means you have to consider if they give you information about the person's roles, values, and goals, your correct answer should match that. So if it does say a person is a parent, a home maintainer, and a gardener, and they have MS, you need to think about how does the MS impact upon the person's roles of a gardener, a parent, and a home maintainer, okay? And that will be key for picking the correct answer. And again, the task on the exam outline specifically states you need to know how to develop and update the occupational profile by information about the functional skills, their roles, their culture, their performance context, and prioritized needs. Chapter 3 in both review and study guides provides foundational information about how to individualize OT practice and how to develop and use an occupational profile. So it relates to the roles and the culture and the context and prioritizing needs. And then again, chapters 6 through 10 cover the body systems and how they would impact upon someone's functioning. Interactive reasoning. As was in the prior hint, the NBCOT exam says therapeutic use of self is an essential competency for both OTRs and COTAs. So therefore, answering exam items, you need to use your interactive reasoning skills. So if it says initial session, you need to think about building rapport. Okay, you're not going to do something aggressive that may make the person feel pain or overwhelmed because they will not come back tomorrow. So if you see initial session, say to yourself, is this going to build a good relationship? If you see discharge planning, think about, do the family or caregivers need to be involved? Teaching learning styles, how we work with a preschooler is going to be different than how you work with a middle schooler or high schooler. So think about Piaget, okay? And then successful collaboration. The NBCOT exam outline specifically identifies the ability to work with people on the team as a very important part of the COTA and the OTR role. So you need to know that. Now, typically when we're thinking about interactive reasoning, it's related to case studies that you've done or people you've worked with on fieldwork. And sometimes applying these to an objective exam item can be challenging. That is why both in the review and study guide and in our course, we have a number of sample exam items that help you think about how interactive reasoning can be applied to answer the correct question. The other thing I wanted to bring up, how interactive reasoning can be tested on the exam, is working with individuals who speak in other languages other than English. In the practice analysis, more than 40% of OTRs said they communicate in languages other than English. And in the COTA practice analysis, it was more than 30%. So since this is a high percentage, you may have a question which requires you to use an interpreter when you are doing evaluation or treatment. Pragmatic reasoning. Okay. As I mentioned in the first slide about reasoning, your correct answer needs to be a choice that is doable. So you need to think about length of stay. Okay. In acute care, you may have maybe 2 to 5 days to work with someone. So if that an exam scenario had that the person who was the parent, the gardener, and the home maintainer, and they had MS and they were on acute care, your correct answer is likely not going to be raising the vegetable and flower beds so the person can access them from a wheelchair, because that would not be a focus on acute care. Acute care is triage. So knowing the characteristics of the setting is key. Fortunately, chapter 4 provides a lot of information about practice settings. Okay. Knowing your reimbursement with Medicare is also key. Knowing what durable medical equipment guidelines are, knowing what homebound guidelines are, and knowing legal. The exam outline for the COTA and also for the OTR identifies a task of that we have to provide our services in accordance with laws and regulations, and that is required. It's also an ethical responsibilities that we are aware of current laws. So there is a lot of information in chapter 4 about ADA, IGA, OBRA, and HIPAA. Okay, so do review that information because your correct answer must be legal. And then client factors, which is in chapter 6 to 10. If someone has a comorbidity of CHF or COPD, their decreased vital capacity is probably going to limit the activities you can do. So pay careful attention to those client factors to select the correct answer. Okay, since I am Therapy Ed's review and study guide editor, I'm an instructor, I'm the director of education. I've been doing exam prep even before Therapy Ed when I was a program director. So I get asked a lot of questions over the years. So I did an article just recently, November 2020, in OT Practice. And here's the link, and that link is also in the chat box on our exhibit hall. Okay. But the number one answer is always, how best do I prepare for the exam? And as was mentioned by speakers this morning, it needs to be individualized. There is no one size fits all. It's very multifaceted. But a very important thing is that positive psychological outlook. I was very pleased that Dr. Williams, when she ended her presentation, towards the end, there were students talking about how they maintain that positive psychological outlook, and that is key. And that can be difficult right now, but if you keep your eye on the prize, as we say in the course, and the students in the presentation this morning mentioned that, why you want to be an OTR, why you want to be a COTA, it can help put things into perspective. And remember, you got this, okay? You have succeeded in your academic and fieldwork. And academic coursework and clinical fieldworks are not easy. People do not pass you because you have kind eyes. They pass you because you have demonstrated competence. And so you are competent. Now you just need to get through the exam. And that's where you have to use those effective exam test preparation skills. So this is not the time to change what has worked for you. Again, that was emphasized this morning. You may have different ways of learning than your peers. Okay, so do the things that worked for you, that got you through your curriculum. Listening to content that must be mastered. Record the things from the review and study guide that are challenging to you, and then listen to them in your car. Basically make your own podcast. There are a lot of good podcasts out there, but sometimes the things that they are focusing on may not be things that you need to focus on, but you have other things that you want to focus on. So make a recording. Also making those notes in flashcards. Again, going through flashcards, as was talked about this morning, can be very passive. Making your own flashcards that are targeted to your needs is much more active. And again, the value of studying with small groups or a partner. Unfortunately, we do have Zoom and FaceTime to be able to do that across the country. And again, that's a very active learning. You could teach your peers, you could do Jeopardy games. There's so many different wonderful ways that people do. And all this information is in chapter 2 in the review and study guide, and expanded upon also in our course. Okay, also what are best? There are some quality products out there, and I definitely want to say both the AOTA and the NBCOT, are both ethical professional organizations, so you can trust their content. Unfortunately, some things out there are not as current and relevant, and so do, as was mentioned, be very cautious and check the reputation of the provider before you spend money. That said, I am very, very proud. Since 1998, I have worked with the chapter authors, many who are leaders in the field and content, and all our content experts, to make sure that we are accurate, current, and relevant. We're updating all the time. We make sure that we use the resources that NBCOT identifies as the foundation for the exam, and we also make sure that we stay up to date with what NBCOT is reporting so that we do cover fully the content knowledge. So we update for every new content outline and practice analysis that the NBCOT publishes. And student feedback on these success on these efforts has been very positive. We're in the 4th edition of the OTA Review and Study Guide and the 9th edition of the OT. And we have new features as per those exam hints that I just was showing you that highlight must know content. And then there's also caution and red flag boxes. And again, that video that's on the booth about the review and study guides will give many examples for this as I walk you through the book in that video. I do want to highlight that the end of the content chapters, which are 3 to 15 in the OTA Review and Study Guide and 3 to 16 in the OT Review and Study Guide, there are open-ended questions. So it's a good way to see, like, hey, did I get the key information that I needed from this chapter? So you know that what you need to study. And there's comprehensive answers that are provided in the appendix. And these questions are meant to engage you in thinking about the knowledge you acquire from each chapter. Remember, rote memorization doesn't work on the exam. You also need to think and really reflect because you're going to have to analyze and apply. Now, each review and study guide chapter is in outline format, so you can be very focused. Remember, you're preparing for an objective exam. You're not composing a treatment plan. So studying in bulleted outline format is very effective. And the other thing that I highly recommend is to read chapter 2 in whichever review and study guide you're using. They give guidelines for structure and review for your exam prep plan. Many people jump right into studying from the book, and that can be overwhelming. You really need to think about what is it that I must study and what is it that I maybe just need to review. So think about your academic history. We all have had courses we've done better in than others, and assess your knowledge of each chapter's content according to this 4-point scale. In that chapter, we provide guidelines then on how to use that scale. And basically, things that are rated as know nothing or know very little becomes must study, and things that know well and know adequately will become your review. In our course and in the course manual, we have very detailed forms that outline each chapter and help you assess your knowledge of each chapter and the content. And then the course manual also then walks you through the chapter as if I and the authors are talking you through the book and saying, this is how it plays out on the exam. But make sure you read that and really develop a study plan so you're not randomly doing things that maybe you don't need to study as much as others. Okay. And as was noted this morning, don't spend 5 hours on one topic. Review something that's easier to start off on a positive way, then study something harder. Review, then study, review, then study. That will prevent you from burning out. Do pat yourself on the back and build a positive attitude every time you master a content area, and focus on what you do know, not just what you don't know. That's going to be on the exam too, and that will also build your confidence. And then nurture yourself with small rewards, a walk, ice cream, playing with the dog, video game, so that you don't burn out. As was noted this morning, people are not studying 8 hours a day for the most part for 14 weeks. It's 4 to 6 hours a day, 4 to 5 days a week, over 4 to 6 weeks. So be conscious of it. Of course, everybody's exam prep plan has to be individualized based upon your life circumstances. The review and study guides include access to our learning portal, which have 3 exams that are purposely designed to simulate the NBCOT exam for the OTR or the COTA. So we basically have the same format. And as was mentioned by Dr. Williams, you really do need to practice doing it in 4 hours. And that's why we have those questions at the end of each chapter, more open-ended to help you jumpstart your studying plan and exam prep plan. But do take the exams in that 4-hour time manner. And we do give advice before the exams about actually planning a 10-minute break so that you actually take the exam in 3 hours and 50 minutes, because as Dr. Williams noted, once the exam clock starts, it keeps going, okay? And the therapy ed review and study guides sometimes look very daunting because they're thick, but remember, half of each book is the provision of comprehensive rationales for all the exam items, correct and incorrect answer, because understanding why you got something right, understanding what you may have missed to have an incorrect answer is key. So there is almost 400 pages in each book devoted to the devoted to the rationales. Okay, again, we give guidelines, including the time management information, and basically how to do it in that manner that simulates the prometric exam experience. And we also spend quite a bit of time in the book and in the course providing guidance for students with disabilities to make sure you get the testing accommodations that, if you're eligible for, you can obtain, because that is critical to make sure that you're able to complete the exam within the allotted time. And if you need double or half time, you should definitely have that, double time or half double time. So 6 hours or 8 hours you can get for extra time if you have testing accommodations. We strongly advise students to first study before they take a complete 4-hour practice exams, because if you take one before you study the foundational information, you're just basically going to get feedback that you need to study, and you already know you need to study. And that can make you feel not very good about yourself, lower your self-esteem, and make it feel more overwhelming if you see a score that's very daunting. After you, though, implement the study plan, you can then, when you get the feedback, it'll be very targeted. And the feedback in the review and study guides cover 9 content areas, so very specific, so then you know which chapters you need to study. And that can help you develop a targeted study plan. And you'll see also what you got right, which builds self-confidence and boosts your self-esteem, which is key for psychological success on the exam. Again, implementing a study plan and learning to determine correct answers can be daunting, though. So to enable effective and stress-free, we have a philosophy at Therapy Ed. There is no need for this to be overwhelmingly anxious. The exam is fair. The exam is doable. But to help you negotiate that and get to that point in understanding is we do offer 2-day live prep courses for the OTR exam and a 1-day prep course for the COTA exam. They're very highly interactive, very intensive. We have a video on our exhibit booth webpage, and it's also available on YouTube, the Therapy Ed YouTube channel, that Kara Inda talks about the course. So you can get more information by viewing that. We also have free online weekly office hours every Tuesday evening, where a content expert reviews targeted must-know information, and then we have an open Q&A. They're scheduled Tuesdays, 7 to 8 Eastern time, and we can go to 8:30, and sometimes we do if people have a lot of questions. And again, recordings of these are posted on the YouTube channel for a month after the session. And then we have personalized individual and group tutoring, and there's a video about that resource on our exhibit booth and again on Therapy Ed's YouTube page. I hope this session provided you with relevant information about and an overview of NBCOT exam, because Dr. Williams did a very good job this morning. But the exam prep resources that can help you succeed on your certification exam. And I hope it helped highlight how clinical reasoning can help you select the best answer. As educators that are committed to student success, I and the Therapy Ed team respectfully ask that you consider the following questions, though, before you purchase certification exam products. So before, you really want to ask yourself, does it provide current and accurate information about the NBCOT exams, the content, format, and procedures? Again, the statement that the NBCOT requires specialized knowledge is false. It's a generalized exam. Okay, so make sure your provider is giving you accurate information. And again, you could check if it's accurate by going to nbcot.org. And also, if it's comprehensive and organized, and is it well integrated, so it's directly related to the content outline and there's not content gaps. I reviewed something about with CVA, and all they had about was with CVA was the use of NDT. There was nothing about cognitive perceptual issues, and there was nothing about contemporary motor learning theory, both of which would be on the exam, because those are current practices and significant issues that OTs need to be aware of and working with. So make sure it is comprehensive and well integrated. Does it also provide effective test taking and time management strategies, so you learn how to correctly answer exam items and complete it within the allotted time? Again, our 4-hour exams are perfect for that, for learning space. And the course does a lot on time management. And do the practice exams reflect the different types of exam items? So again, the CST for the OTR, the multi-select 6 option items for the COTA exam, and then your traditional multiple choices. But if you're only doing traditional multiple choices, they may give you a false sense of security. And are there real-time experiential learning opportunities, such as our live live right now? The courses are online, but they have been in person for decades now and will likely return to in person. But even with the online, they're very, very interactive. And do you have individualized live supports? We have our free office hours and we have our tutoring. And most important, are the product providers experienced and well-regarded educators who have reputations for excellence, integrity, and service to the profession. If you Google any of our therapy ed instructors, you will see that they are people who have given a lot back to the profession, by service to AOTA, by service to state associations, by publishing, by teaching. Okay, they have very solid reputations, and I'm very proud of that. And I'm very proud that the quality of our products and the resources and the expertise of our course instructors and text contributors will enable you to firmly answer yes to all of the above questions. So I thank you for your time. And for more information about Therapy Ed's exam prep resources, please see therapyed.com. Thank you.